So there are really three issues when picking a tool. The first is reliability. Can you count on it? The second is validity. Does it measure what you want? And the third is feasibility. Now, just a few years ago, I wrote an article called Beyond Measures and Monitoring. It's well established that measuring our alliance and progress along the way contributes to engagement and better results at the conclusion of treatment. But the question therapists often have is, which measure should I use? And the marketplace of measures has exploded since we first developed the ORS and SRS back in the year 2000. The truth, however, is, this is what I wrote about in this article, that most of these measures used for assessing psychological care measure a single construct, and that is either distress or well-being. Most of these tools have already been vetted in a number of studies for reliability and validity. So really that leaves feasibility. Not every person who goes to the doctor, for example, needs an MRI or a CAT scan. Oftentimes, a very simple technology like a stethoscope will suffice. And that's what feasibility is really about. And I'm proud to say, actually, that the two four-item measures known as the ORS and the SRS really are feasible. Measurement-based care has suddenly become very popular, and the marketplace of measures is flooded with measurement tools, each claiming to measure some particular aspect or some special population. In addition, there are a variety of free tools that are available. Are these tools valid and reliable? The answer is absolutely yes. The real question, however, is, will they provide you with the kind of feedback you need to improve engagement and outcome? And the ORS and the SRS have been tested worldwide with millions of cases, and most importantly, interpretive algorithms. Algorithms that look at your performance and look at what's happening in the room with your client and say, hey, you're on track, keep going. Or maybe you should have a discussion with your client in order to fine tune and tailor the treatment to better meet their needs. Doing so, the data is fairly convincing at this point, improves both engagement and outcome. There are many randomized controlled trials and now many meta-analyses which indicate that monitoring client progress and the status of the relationship while the client is in care improves both retention in care, that is, it prevents dropout, and it also augments progress. In other words, clients who might be at risk for a negative or null outcome, when we monitor their care and speak with them about it, the probability of success actually improves. There are so many studies. What I would say that the interested reader should do is go to the International Center for Clinical Excellence website, click on the tab that says Tools, scroll down, and you're going to find a spreadsheet of dozens and dozens of studies looking at the reliability, the validity of the tools, and also the impact that using such measures has on retention and progress. The real impact of seeking feedback from clients about their experience of the relationship and progress in care is that therapists truly want to know. The death of outcome and alliance measurement is when therapists are told, you must do this, or it's not going to help you. Sadly, even though the research literature indicates that monitoring the alliance and outcome of care improves outcomes, some simply won't do it. So I have to say, I feel a bit conflicted about such mandates. It's sort of like masks and and hand washing. Should you do it? The data is quite positive. Should someone have to tell you how to do it? I wish they didn't.